Hi, hi, this video is dedicated for Angelica's silliness. Sorry, because I have actually quite a lot of readings today, so I got like make an opening, then I could detect the video easily. So now we have the 12 months reading. We have the March to August, September to the February. So it's the 12 months, right? So basically, you were saying in the messenger that day it's about the taking of the hormone pills and whether it's easy for you to get conceived or not. Um, you know what? Yeah, I think that's good news though. So okay, so we start off with the March to August first. So for March, your body is reacting against the hormone pill. Um, the ovary wise, it's fine. Like they are now producing, they are working, just that it is not it's not the ovary wish to do it, it's by force. So that's the reaction of the hormone pills on your ovaries. So from the sound it may sound bad, but in terms of conception, that effect gives you a chance, right? And then in that's for March. And then for April, your I believe you had failure in the past, very very bad before, and in April your chance goes back to 50-50. It's getting better, even though you have doubt on it, but it's getting better, stable. And your ovary, it's doing its job slowly in April. And then your forecasted pregnancy conception would be in May. In May, yeah, in May. And then blossoms, yes. So your conception, predicted conception, 60-40, 60% positive, 40% failure. And that's why it's 40% failure. It's your mindset, your emotion, all these things, but it's minor, but I believe it's quite positive for May, right? And then in June, it's that your ovary needs some rest, and you would probably need to ask the doctor what else you can do to make sure the hormone level, there's a balance between estrogen and progesterone. So what's the real problem behind all this? You will need to know and ask the doctor. Is it the progesterone problem or an estrogen problem, or is it because the ovum stuck at the fallopian tube, or is it because of the cyst? Because the thing here, because the side effect, March, April, May, it's not yet coming out, but it's giving pressure on your ovaries, because your ovary is forced to do its job. March, April, May, June. This is in June. And then in July, your fertility goes back as if like normal, even though it's because of the something else which makes it, but not so bad yet. The side effect is not so bad. The fertility, it's quite good though in March, April, May, June, July, and August. July and August are another 2 months where you can try. So the conception are actually quite high between March to August, right? So, okay, so March and August are quite high. So I would say the highest month should, between March to August, it's May. May. And then because May is like 70-30, I amend that again, 70-30. Then July and August are 60-40. That's all for March to August. And then the highest is in September. September, just be careful. Your ovaries are now tired and you need the nourishment for the ovary. September, it's another one. Okay, but your ovaries, beware, it's tired now. It's tired and you need to do something on the ovaries, because remember, hormone, it's like a chemical to induce the ovary to do its work. and indirectly it's like forcing the ovary to do its work. So if your ovary doesn't function properly, there's a reason behind it. Why? That's the scientific reason behind it. So it's now your this lady is the ovary and it's forced to do its job with its eye closed. Okay, then you need to get more supplement to um, love your ovaries, probably like evening primrose oil, regulate the hormone, make it normal. Okay, then September, October not really, because it's not your problem, it's the external factor which causes you the problem. October wise, actually it's 50-50. It's not so much, it's more to the external factor, stress factor, all these things. And in November wise, November and December are more. November November let's see about November, you are quite strong in terms of career or something else, but in terms of conception wise, that nourishment is back, slowly comes back, always it's slowly getting back to its normal, like it's very slowly start getting back to normal slowly in November. And then that's one more thing you need to concern is, I'm not sure if the environment you live it's messy or not. That's one thing which actually does affect your emotion. In November, that's November. December, no. January, it's 50-50, not really. And then your fertility system, it's now tired, need some restoration. All right, so if you don't know the traditional method, you can PM me later on, like how to make the, if I'm not mistaken, it would be your ovulation problem, right? I'm not sure about that, but it seems like an ovulation problem. February, another last chance is in February. All right, so the highest for September to February, it's September, no doubt. February will be second, and then September, October, November, it's this one. Actually you have, but the work stress is there. I'm not sure you're working, but the emotional you have it, it's the obstacle for your conception. All right, then now when I ask whether this year you could get conceived or not, the hope is that there is a hope, but behind the hope, you are taking additional things into your body, which makes you tired, which makes you fatigued, and this is what you have been taking. You have been taking this into your body. This is the man trying to take to gather the medicine and to consume it. That's what you have been doing, and you have been making your body tired. But I'm not sure if it is just the hormone pill alone, or is it other things as well. Other factors seems to have contributed to it. And ovaries now getting fertility system is getting back to normal, but ovary, it's a bit tired for now. That's why it seems that the ovary is not working on its will. It's by force to do its job. Right, this is the whole summary reading for your 12 months. So please remember your conception month. All right, and then now to answer your question, will I be able to conceive? Yeah, let me see. This should be a combine. And is your ovary okay? Okay, so these two, I will be merging these two together. Is there any chance that I will ever get pregnant? Yes, as explained earlier. So the first two questions will merge. Okay, basically you can get conceived but the body is resisting against it. This is, I don't see any relationship problem. When I draw this card, it's mostly related to relationship, but in this one it's like no, because the relationship is there, but the body, it's not working on its will, it's by force. See, someone is kicking it, someone is forcing it to do its job. So that's the thing. That's why you have the conception, but later on you may have side effect of that, so you have to be careful of this. And then getting tired, fatigue, and then you will need healing. The first thing first, evening primrose oil, I'm quite sure you need that. And then you will need don't get essential oil to involve first. Essential oil you don't apply on your skin for your matter, because you are taking the hormone pills. You are advised to diffuse it or to burn it with the salt. Let me show you how I do it. It's like that, and that's how you should do that. If you see it, that's the salt, that's the light bulb. So that's how I pour the oil, like 1-2 drops, and it should work. It works. So those are the crystals. So that's how you should do it. And in terms of the diffusing method to make you calm, so clary sage and geranium would be better in terms of the conception, and also about the balancing of the hormone. So your body definitely will get better. Oh, okay, I think that's the confusing part of the camera direction. Body will definitely get better, right? And then it's time for conception. It seems like this year the conception is there, but the price is that your ovary is tired. Yes, healthy pregnancy. Please keep checking with doctor, because this is the one, but this is the man which gives you this thing. And the things, it's working, right? It's working. And then healthy pregnancy or not, it's healthy. Let's see. Yep, it would lead to a full conception. It would lead, because initially it's a very bad conception. I don't know if you are PCOS or cyst or what, but it's quite bad. And then you will lead to a completion, and you are now becoming better in terms of conception. So so that will also mean pregnancy is okay, no problem, just your ovaries are tired. Okay, and then I think you forgot to ask about gender, dear. Yep, I'm actually seeing positive results. So far, gender has not been shown, but it's more likely a man now. It's more likely a man. It's a bit more, you need a bit more time, like 2 more months, 3 more months, 2 to 3 more months. I think the news is coming. The ovulation will be going, it's working, but whether the fertilization will occur or not, it's all now entirely depends on your body now. So it's working. And let me see something for you first. Checking your chakra. I need to look at the photo. Let's see if something I can go through. Root, sacral, solar plexus. Just up to solar plexus is enough like that. Never mind, just up to heart chakra. Okay, so you know your root chakra, it's very bad, awful, and your body, despite it's undergoing the improvement evolution, it's getting better, but I am saying it's because of the something forces you to do it. So it's not by natural method, probably because of the hormone pill. This is your root chakra. Root chakra would mean your base chakra, located at the very last of your backbone. You're not stable, you're afraid, emotional, and unable to make decision. You are scared. If you miss this conception again, then it's like afraid. So the ailment behind this emotion kind of healing, it's through the essential oil of diffusing. You can burn it with pink salt like I did earlier, I'm always doing it. You can use your diffusing using the water vapor to diffuse it, right? And then the second one would be the stress. Our sacral chakra, your fertility system, is undergoing the stress, and then it's entirely locked, unable to function on its own. So the heart chakra, the solar plexus, digestive power, digestion power, that's fine. Will to survive, fine. Able to make a decision, fine. But the heart is a bit weak, because this problem, conception problem, does give you a problem, and in fact it actually does make you a bit hot-tempered or disappointment or those negative emotion, which induces the quarrel between you and your other half. So now, how does the hormone pill reacts with your sacral chakra? Sacral chakra means reproduction system. It does give you the positive hope. The chance to conception, it's there for the hormone pill. But the problem is, how do you recover your ovaries, your fertility system? That's the problem. Go for natural method treatment. I don't know where you stay, but if you have aromatherapists out there, please do approach them. Or if you need help, do let me know. And then I do not know if you have and then all about this kind of natural treatment, going to out park, essential oils, all these things. So for now, what I'm actually suggesting is that get it. These are the oils. I think you might need it. I don't know if my clary sage is here or not. So I think it's here. Okay, so this is what you can find. The famous brand, which actually does appear in the worldwide, called Oshahi. So you need to keep finding the smell. I know which smell I need that Oshahi, OSHADHI, and then you will definitely need clary sage. Make it nearer to you. And then it's another one is one of the most important for women. It's geranium, Florihana. You can screenshot and try to find on your own. This is another brand in my country, geranium. All right, so they will definitely be able to help, but don't try to apply on your skin first, because your hormone pill is working. I don't want the essential oil actually blocks your hormone peel treatment. So that's the thing I'm saying. Never try to use that on your hormone to use on your skin, because the essential oil eventually will block the essential I mean the hormone peel treatment. Another one you can find is this brand Alvicmia. Try to find this. This is the baby essential oil. This is one kind of perfume made from essential oil. Okay, so it does actually reduce the anxiety and the panic. It is usually adopted by the pregnant woman, especially after the pregnancy. So it does help to especially when the mother gets fed up of feeding the baby milk, because mother has to wake up like in the midnight, like throughout the night, 6 months, 9 months to do it. I think for the first 5 months is torturing, so they rely on this to feel better. So you can use that as well for when you're undergoing this treatment, right? If you have any more questions, do let me know, right? Thank you so much, Angelica.